would now like to hand the conference over to your speaker today, Mr. Michael Schumer. Thank you. Please go ahead, sir.
Thank you, operator, and thank you for joining us for the COVID-19 daily media call for June 1st. Governor Walz is not on today's call. We'll start with a situation report from Commissioner Jan Malcolm. Following Commissioner Malcolm, we'll get an update from Infectious Disease Division Director Chris Ersman. We also have State Epidemiologist Dr. Ruth Linfield joining us on the call today. After the opening updates, we will take questions from reporters on the line. With that, I will now turn it over to Commissioner Malcolm.
Thank you, Mike. Good afternoon, everyone. Before we get started with the update today on the COVID-19 data, I'd really like to talk just for a few minutes about the context we're all in right now. Obviously, the events of the last week have led many Minnesotans, and indeed many people across the nation and internationally as well, to need to come together to give voice to concerns and demands. And some have said that this is one of the most turbulent expressions of social unrest and protest since the late 1960s. Our society's continued struggle with racism is not an isolated problem of a specific time or place. It's a fundamental public health challenge that expresses itself in many ways, from negative impacts on the lives of individuals and families to persistent community-level disparities. The Minnesota Department of Health has been working to document and call attention to the reality of health disparities literally for decades. About 20 years ago, we published one of the first reports in the country from a state health department that linked health outcomes with social and economic conditions in our communities. Then a little over 6 years ago, MDH released a report that clearly called out the structural barriers that systematically prevent some of our people from reaching their highest potential for good health, explicitly naming structural racism and the inequitable maldistribution of opportunity as root causes of the persistent and glaring health disparities in Minnesota, some of the worst in the nation for people of color and American Indians in Minnesota. Since that time, we've worked hard with our partners and made some progress, but it is frankly frustratingly little progress, and we're all very aware that much, much more needs to be done. We must continue our work to address these health disparities and the long-standing stain of racism in our communities, our state, and our country. The data on COVID-19, as we've talked about before, provides yet another reminder that health disparities remain a huge problem in Minnesota. For example, we've mentioned that Minnesota's African American community represents 6.6% of our state's population, but over 22% of all COVID cases and over 20% of all COVID hospitalizations. Minnesota's Hispanic community represents 5.5% of our state population, but nearly 20% of COVID cases and over 13% of COVID hospitalizations. And we're concerned that all Minnesotans, but especially our hard-hit communities, might face additional risks associated with the large gatherings this weekend. And of course, this is happening in the context of many people from many communities already moving away from social distancing as we have moved from stay-at-home to stay-safe guidelines. With people coming together, community members and public health workers have been reminding everyone involved that we are in the midst of an active epidemic and that we need to continue to take steps to limit the risk of COVID-19 spread. We very much appreciate that masks were distributed by a number of community organizations at gatherings over these last few days. These actions are essential to protect everyone's families and the larger community. This includes wearing cloth masks when in public and maintaining social distancing as much as possible. Because as we've said for many weeks now, and it remains the case, we do have considerable community spread in the Twin Cities and indeed throughout the state. We need the help of everyone involved to prevent additional suffering and preventable death by continuing to follow the public health guidelines to limit the spread of COVID-19. These are really difficult days. In times of pain and grief, we want to come together, both to comfort each other and to collectively work for change, for a better future for us all. And the ongoing COVID-19 pandemic certainly makes this more difficult. As we find peaceful ways to express ourselves, we just want to once again ask for everyone's help to protect themselves their loved ones, and our most vulnerable neighbors from additional suffering and pain. So now on to the daily data update. As of early this morning, June 1st, around the world, we were approaching 6.2 million cases and just over 372 deaths. Here in the United States, as of this morning, we were very close to 1.8 million cases and just over 104,000 deaths. Here in Minnesota, we are at a new total of 25,208 cases. This was an increase of 361 from the prior day, followed by an increase of 656 on Friday and 661 on Saturday. So you can see that the daily number dropped pretty notably yesterday. The case doubling time is now just over 20 days, which continues to be a lengthening of the case doubling rate over the last couple of weeks. We consider that to be a good sign. Sadly, we have a new total of 1,050 deaths in Minnesota. We crossed the 1,000 mark on Friday, as you know. There were 30 deaths reported on Friday, 14 on Saturday, an additional 10 yesterday that we are reporting today. So again, bringing that total to 1,050. The most recent day's total reflects 4 persons in Ramsey County, 3 in Hennepin, 2 in Dakota, and 1 in Wright County. 4 people in their 90s, 4 in their 80s, 1 in their 60s, and 1 in their 50s. 8 of the 10 deaths yesterday were among residents of long-term care facilities. As of today, there are 549 patients currently in the hospital, 263 of those in ICU care. And those numbers also have bounced around a bit in recent days, increasing some days, falling other days. We've had, for example, rapid, significant increases and decreases over the last week in the ICU and non-ICU levels of care. So the hospitals were very busy this weekend, certainly with a combination of reasons for the increased hospital utilization. I think I will also just mention the testing status. Again, there's been a pretty significant overall increase in the amount of testing, with several days over 8,000. Toward the end of last week, 8,635 on Friday, just over 7,000 on Saturday, and just under 6,100 on Sunday in terms of the numbers of laboratory samples that were processed by the labs. The Public Health Laboratory was not processing results since Friday afternoon, but has started up again as of this morning. I'll also mention that, as you probably are well aware, June 1st is the day upon which restaurants can reopen for outdoor dining with certain conditions in place, and personal services like salons and barbershops can open at reduced capacity. Department of Employment and Economic Development Commissioner Steve Grove has been a leader in this work. He's not able to join us on today's call, but I will remind businesses and others with questions that the latest guidance for businesses of many types is available on the DEED website at mn.gov/DEED/guidance. While we know that there will be, I'm sure, variability in how businesses statewide might be reopening today, and we don't have specific details on exactly how many are opening, we just will remind that each business that reopens today is required to have preparedness plans. Those are not required to be submitted to the state for approval, nor do they need to tell the state that they are reopening, but they do need to provide their preparedness plan if requested. Again, I'll just note that we're still in the middle of the COVID-19 challenges, and working to find that important balance between helping businesses to reopen as quickly as possible while prioritizing health and safety of their workers and their customers. I, at this point, would like to turn it over to Chris Erzman for a few additional updates. Thanks, Chris.
Thank you, Commissioner. I just wanted to talk about two different things. One is that we have been made aware again of the desperate need for blood donations. There's a lot of interest among Minnesotans to help in any way that they can. And we have heard that blood supplies are low in some of our communities, and so we are encouraging Minnesotans to help their communities by giving blood. And I want to reiterate, as we have done in the past, that there are safety precautions in place that are being taken by the blood centers to limit risks of those donating blood. So if you are able to donate blood, there is a desperate need, and we would encourage you to do so. Then I wanted to highlight some positive work that was done over the weekend. Our laboratory, and I'll start with our laboratory. As the Capitol complex was notified to evacuate around 2 p.m. on Thursday, our public health laboratory had to quickly transition from testing to a different response and to plan for the laboratory to be closed immediately and through the weekend, which is almost an unprecedented event. The majority of staff were able to be out of the building by 2:45, and an immediate notification went out to partners to suspend all transport of samples to the lab for testing. A small crew stayed behind on Thursday to finish some sample testing, to store the rest, and to receive any samples caught in transit through the notification. And I will note that there are certain conditions that have to be made for samples to be acceptable for testing. And as you know, collecting specimens requires a great deal of work and effort, so we wanted to make sure that no specimens were lost. There was a small crew from the infectious disease lab and our newborn screening lab that came in Friday morning. The infectious disease crew finished all the COVID testing. They ran 1,319 samples between Thursday and Friday. Performed the daily rabies testing, which is critical, and newborn screening was able to finish up the samples from the day before. The lab worked with the Testing Coordination Center to make a plan for specimens that were supposed to come into our lab on Friday through Sunday. Some were received on Friday and frozen. Others were able to be delivered to Mayo, and some were frozen by the National Guard and delivered Monday. The environmental lab and our newborn screening sections were able to work with their partners and hold samples through the weekend. So a lot of work that happened quickly in the laboratory to ensure both the safety of the staff as well as preserve the integrity of the specimens that were collected. And then I also want to mention briefly the work of teams working with our unsheltered homeless population. In response to the emergencies of both COVID and the increasing urgency that the civil unrest created, the state's Interagency Council on Homelessness led an intergovernmental public-private team that helped nearly 200 people transition from outdoor encampments to hotel space in Minneapolis and St. Paul over the last few days. The efforts served 70 people from Sabo Bridge Encampment in Minneapolis on Thursday, 40 people from the History Center in St. Paul on Saturday, and 72 people from the Stevens, Cedar, and Greenway encampments in Minneapolis on Saturday. All of these individuals are now in hotels supported by state resources in partnership with some remarkable community partners, such as Avivo and Start Today. The resources being used to provide these emergency hotel resources and supports will also assist people into housing. An additional volunteer-led effort secured temporary accommodation for 150 people from the Greenway encampment into a nearby hotel. A state team is working with volunteers, nonprofits, philanthropy, and local government right now to figure out how to help sustain this location as well. Volunteer teams of local public health staff went to the hotels where people were evacuated on Saturday to conduct symptom screening, and MDH and local public health are following up with hotel teams about ongoing symptom monitoring and screening. So thanks to all of those individuals who worked so hard over the weekend to ensure everyone's safety. I'll turn it back over to Mike Schomer.
Thank you, Chris. We will open it up for questions now. As always, we ask that reporters limit their questions to one primary and one follow-up, and that we limit the number of questions from each outlet so we can get to as many as possible. With that, operator, we are ready to take questions.
Thank you. As a reminder, to ask a question, you will need to press star 1 on your telephone keypad. Your first question comes from the line of Jeremy Olson from Star Tribune. Your line's open.
Thank you. Commissioner, you had mentioned this briefly already, but if you could elaborate a bit. You do expect that the protest activities over the past few weeks, that it could have a bearing on the state of the pandemic in Minnesota and on the number of cases?
We certainly think that's possible. There are a number of factors. Obviously, we know that concentrated gatherings and loud talking, singing, yelling, all those loud vocal expressions exacerbate the risk of spread. Mitigated, though, by the fact that this was outdoors. So I don't know that anyone is in a position to make any specific prognostications about this, but we think it's certainly a possibility. But as mentioned, though, too, it's going to be difficult, I think, to tease out the effects of several variables that are happening at the same time.
And I guess my question is, does this result in any change in your kind of public health strategy? I mean, is there anything you can advise or do differently to account for this new threat?
We certainly are going to be paying very close attention to, a number of different measures that we look at for surveillance data, and Dr. Linfield or Ruth could comment more on that. But we'll be looking closely at the data. We'll be urging people to even perhaps more carefully monitor their symptoms, especially if they were participating in these events. But really, everybody should just be on heightened alert for any symptoms, and to absolutely quarantine yourself if you are sick. That guidance has always been there, but even more important in the next couple of weeks. And please seek testing if you feel in any way symptomatic.
Thank you.
Your next question comes from the line of Catherine Richard from Minnesota Public Radio.
Yeah, I just want to follow up on Jeremy's question. I guess we've worked really hard to build up that capacity in hospitals. Are you talking to hospitals or advising hospitals to pivot a bit now when they might be seeing both injuries from the demonstrations, as well as, and in addition to, potentially more COVID patients? How are you advising them on this?
Well, they and we continue to be in really close contact, sharing data on resources and on bed availability and staffing and ventilators, et cetera. So that collaboration continues, and I think, as been mentioned, I think that the degree of data sharing among the health systems and between the health systems and the state is really unprecedented, and is really an essential tool to help coordinate any adjustments to capacity that may be needed as we go forward.
I mean, are you concerned about capacity at this point?
Well, we are still within the range of current capacity. I think I've mentioned on prior calls that a couple of facilities have opened up a few surge beds here and there, but overall we are still above that threshold of where we have at least 5% available capacity. And that is not an atypical level, as I think Chris and Ruth have mentioned in the past. we often run at about 95% ICU capacity during the height of the flu season, for example. So it's not an unprecedented level of utilization within critical care. And Ruth or Chris, I'd invite you to say more if you'd like.
This is Ruth. I will just echo what Commissioner Malcolm said, and that we are in very, very close communication with the healthcare facilities, and certainly all of us are keeping an eye on admissions and healthcare visits.
Just a quick follow-up there. Are you, with the National Guard now being deployed to help with the demonstrations, does this feed into any of that additional testing site capacity you guys had talked about last week? Have those plans been postponed?
You know, we're this is Commissioner Malcolm. We're certainly looking at that right now. I mean, the Guard was able to continue to support some of the targeted testing in long-term care facilities. It's such a priority for us. We do not currently have plans for the same kind of Guard-based mobile testing sites within the next few days. We'll be revisiting that. We will have a goal and a priority to have increased testing available. As I just mentioned, it's going to be important that everybody monitor symptoms and seek testing right away. So we are working on plans to expand testing availability. But certainly the Guard's deployment to these other critical activities kind of at least changed our dependence or our reliance on the Guard for the near future.
But Jan, can I also add that we wanted to make sure that people were very aware that the Guard members who were doing the testing in long-term care were Guard members who had a background, a medical health care background, and so many of the Guard that are providing security to our cities have a different background, and so there isn't necessarily overlap. So in other words, infantry Guard members have not been asked to do testing. So just to be clear again, that the Guard members that have been assisting with testing have that special background.
Thank you, Chris.
Your next question comes from the line of Nora Hartel from the St. Cloud Times.
Hi, thank you so much for taking my question. I was hoping you could talk about the decline in the number of deaths that we're seeing in the last couple of days and number of cases. Is that something that we can celebrate, or I guess what's your comment on that? And do you think that it's wrong to talk about peak anymore? I know that up here in St. Cloud, our health leaders are talking about waves of COVID-19 going forward.
Well, thanks for the question. We certainly, every day that we see declining numbers, we're glad for. I think it's too early for any of us to declare it a trend, but we do watch these things over periods of days, and the trend lines are favorable in terms of the rate of case growth, and the hospitalizations are growing at a measured pace as well. Even though, again, when you're adding 300, 400, 500 cases each day, that still is adding in capacity, but at a slower rate than we had seen previously. And certainly, I think. Ruth, Chris, do you guys want to comment any more on either the case trends or the fatality trends?
I do think that we want to be cautious and recognize that we are doing, our emphasis is on testing in long-term care facilities, and the goal is obviously that the testing will inform practice and that will ultimately help to reduce the number of cases that we're seeing. But we also know that as we do testing, we will identify some cases, and so there's a possibility that those cases could ultimately be counted in our deaths. So I think it's important to just keep that in perspective, that we're ramping up, or we're continuing to ramp up the testing in that area. And so while our intent is that we're going to see fewer deaths because of it, in the near term we may continue to see additional deaths. And then I'll just say that I really like the imagery of waves rather than peak. I think that's a good way to think about this pandemic.
Okay, thank you so much.
Your next question comes from the line of Tom Lydon from Fox 9.
Thanks for taking the question. Yeah, obviously, a lot of questions about kind of the rallies and what kind of impact that would be. You just talked about, peaks and valleys. Do you think the rallies that we've seen from the last week will have an impact on those peaks and valleys? And a little bit more specifically, did you have anyone out there in terms of surveillance at these rallies looking at sort of the best practices or worst practices of those involved? For example, do you have a sense of whether most people were wearing masks? It seems so. But on that question of masks, there have been some experts who have said that maybe we're giving the public the wrong impression about masks, that they are that effective. I think even Mike Osterholm has said prolonged exposure in the same place and same environment, even with a mask, is not going to protect you. So do you have any thoughts about what the impact's going to be from these rallies and whether people may be under a false impression about the masks?
Well, I think, again, I'd turn to Ruth and Chris to talk maybe more about some of the surveillance data that we will be watching carefully in terms of whether we had presence out in the gatherings. Not to my knowledge. It's possible some local public health folks might have deployed for that purpose, but I think our observations are drawn just by the coverage and perhaps personal participation that we may have had. In terms of the mask issue, I think we've always been careful to say certainly masks are not a panacea, and masks are not sufficient to protect one from environments that are of sustained risk. However, they clearly are helpful to mitigate risk. And I think we've just talked about it as a cumulative series of things, and certainly keeping physical distance has been really our main thing, to have people not gathering in large groups and staying 6 feet at least apart, and then masking in addition to that does add an additional level of protection. So certainly with these mass gatherings, the social distancing recommendation was not closely followed as we would understand and expect. Ruth or Chris, do you want to add anything?
Well, I will just go ahead, Chris. Fine.
No, you go, Ruth. That's fine.
Okay. I was just going to say that we also do think, though, that being outdoors is better than being in a very closed, confined, indoor type of setting. However, it is hard to maintain a 6-foot distance at a rally. So, this is something that we will just have to wait and see what transpires. We'll keep our eyes open. Certainly, I think just the trauma of the past week, and as Commissioner Malcolm had mentioned, there is a need for people to get together and certainly to protest and demonstrate, and we understand that. And we also noted, in addition to many of the people demonstrating who were wearing masks, that, there were a lot of people in our communities who were out helping others by donating food and by cleaning up, and others who were picking up food, and people, I think, were trying their best given the circumstances. And so this is something we will just need to follow.
Can I ask a follow-up? Go ahead. Sorry, go ahead.
I was just going to add that when we learned that there might be these activities taking place, we made sure that masks were available through trusted community partners, so that if people were attending events and did not have a mask, that they could be offered a mask. Again, recognizing that it's not perfect, but definitely that it could potentially mitigate. So that was one of the things that the department did in anticipation of the need for social gatherings, was to make sure that masks could be available for people.
And what we are asking people now to do is to monitor for symptoms, as we were asking before. But again, and as Commissioner Malcolm said, it is really important, if you are developing symptoms, that you contact your healthcare provider and that you get tested. And we are going to be working with community health centers and clinics to ensure that there is enough testing capacity for people to get tested.
So a follow-up directly on that, since we know that so many people are transmitting this disease asymptomatically, should people who were at those rallies, who had sustained contact with people within 6 feet, because clearly a lot of people did, and were only wearing masks, should they be practicing distance from their relatives in their own home because they may have been exposed? Because what I hear you guys saying is the mask may mitigate, but it does not offer protection if you are wearing it within that closely confined range, even if you're outside. So individuals at those rallies, besides watching to see if they may develop symptoms, should they be staying away from healthy family members to prevent asymptomatic spread?
I'd invite Chris or Ruth to comment on that in terms of the degree of risk is always pretty hard to estimate precisely. I mean, absolutely, that would be optimally protective if folks who participated would do that, just on the chance that they might have been exposed. But Ruth, Chris, don't know if you would have anything more specific you'd want to say.
The only additional pieces you had mentioned around healthy family members, and I'm not sure if you meant to say healthy, but I'd be more concerned about individuals who are elderly or who have underlying conditions, as we especially want to protect those people.
That's what I meant. Thank you.
Yeah.
Your next question comes to the line of Darren Svensson from KPOE Radio.
Thank you. You've all talked about the importance of contact tracing related to COVID-19 spread and getting a handle on COVID-19 itself. With the events that took place in the Twin Cities primarily and other places around Minnesota this weekend, is contact tracing even possible if there was a spread regarding the protests and gatherings that took place this weekend? How big of a challenge would that be?
Well, it's a very good question, and you're right. Just by the very nature of the event, people are not going to likely know who they were in contact with. So it does create a very practical, not just a scale problem, but a practical problem of not being able to identify contacts in the same way. So I think some of the best advice, it really is this more global, general advice of if people were participating, what to be on the lookout for and what actions to take. Ruth, Chris, anything else?
The other thing I would add is that many people might have gone with a friend or a family member, and the risk really is being in close proximity to someone. We feel that is the biggest risk, especially if you're outside. And so even though there are very big crowds in many situations, people who have gone with a family member or a friend will know who they've gone with.
And I'll just add that we are, when we're interviewing people, we are asking about attending mass gatherings and events. So it's not only where the source of potential source of someone's infection, but then it's also people that they may have been with prior to the time that they developed their symptoms. So there's two levels of what we're trying to get at in the course of doing the case investigation, both where they may have acquired infection, if there's a way to get to that, and then people that they may have been in contact with in the 48 hours prior to them developing symptoms. So, yes, I think, as Ruth indicated, you know who you spent the time with in your party, and then also that we are looking at asking about mass gatherings specifically, and then asking about who they may have been in contact with before their symptoms started.
Thank you.
Your next question comes from the line of Paul Scott from Forum News Service.
Hi, thank you. I heard you say we're going to have to wait to see what transpires, and we are advising only those with symptoms to get tested. Of course, yesterday the mayor of Atlanta advised all protesters to get a COVID test. I'm just wondering why we wouldn't advise asymptomatic protesters to be tested.
Go ahead, Chris.
Well, I was going to say, actually, we will be doing that. We're in the process of putting together some materials. So I guess I'm not sure where you heard us say something otherwise, but I'll let the commissioner go ahead.
No, thank you. I'm glad you clarified that. We've certainly been stressing the importance of people monitoring for symptoms, but we, as part of our kind of testing strategy overall, because of the importance of asymptomatic spread, we have begun and will continue to do more kind of surveillance type of testing and testing of asymptomatic people to inform us as well. So that is. I'm glad you allowed us to clarify that.
So if a person went to a very crowded protest and they don't have symptoms, can they go get tested?
Yes.
And should they?
Yes, and we're working to get materials out to healthcare providers so they're aware of that. And obviously there's an incubation period for COVID, so it's not instantaneous that someone would necessarily, be at something today and be sick or start to, be incubating disease showing signs of disease right away. But we definitely are going to be encouraging people who participated to consider getting tested and reaching out to their healthcare provider.
Thanks, Chris.
Without symptoms. Okay.
Correct. Yeah, with Commissioner Malcolm again. I just want to make sure folks heard that last point Chris made about the incubation period. And another thing we know about testing is that if it's done too early, even after someone has in fact been infected, the test may not pick up a positive if they're not far enough into that incubation period. So that's a very important reason why we're not saying everybody go out and get tested now. We are working on kind of the plans for that, the communication, the best guidance and education we can give to people. But just the fact of the incubation period and the optimal time for testing all influences the planning that we're doing now.
Thank you.
Your next question comes from the line of Catherine Richard from Minnesota Public Radio.
You answered my question.
If anyone wants to ask a question, please press star 1 on your telephone keypad. Tom Leiden from Fox 9, your line is open.
Quick follow-up. What 5 to 11 days for the incubation period? And in terms of when you may see a full effect from a week of protests, if that changed our peak or created another peak, you would expect that in 21 days? Just want to be sure on the number. Again, 5 to 11 incubation, 21 days until we may pick up what happened, correct?
No, I'm sorry. This is Ruth. The incubation period is 2 to 14 days. But, yeah. But frequently, people start to get symptomatic between 5 and 7 days. But the whole incubation period is 2 to 14.
Okay. And impact in terms of overall impact from this, you think you may see something in the numbers, I think you've said previously, in 3 weeks?
Yeah, and the reason that this is Chris Ayersman, the reason that we've used the 21 days is because, as Ruth indicated, with the incubation period being 2 to 14 days, you've got to wait till you give everybody those 14 days, and then you have to allow for some time for them to go in and get tested and get the results, and so that's why it takes a little while for the data to come back through the system that we could comment.
Thank you.
Your next question comes from the line of Lee Michaels from Salem Media Group.
Hi, thank you for taking my call. Quick question. I don't think I've heard anybody address this, and my parents had healthcare directives. What role do healthcare directives play in the deaths we're seeing in the assisted living and long-term care? Do they play any role at all?
Thanks for that question. This is Commissioner Malcolm. It's a great question and an important part of this whole discussion. There are a very large percentage of folks in long-term care settings who do have advance directives, and many of them also have advanced conditions of one sort or another. So, the fact that they have an advance directive may make it very clear that it's their preference not to go to the hospital, not to have extraordinary measures. As we've talked about before, we know that some percentage of the folks who are dying with COVID and are counted as COVID deaths if they've had a positive, also have been in hospice and in end-of-life care for some other condition. So I think the presence of long-term advanced care directives is important for many reasons, and certainly does play a role in the course of care with this disease as with everything else.
Thank you.
Presenters, I'm seeing no further questions in the queue. Please continue.
All right. Well, I do want to thank everyone, our speakers and the reporters on the line today, for participating in the call. If you do have a question as follow-up and you weren't able to address it, please do feel free to reach out to our communications office. Thank you, and we'll talk again soon.
Ladies and gentlemen, that concludes.
This has been a WDIO News Special Report.